I'm going to talk about chiropractic services and what Medicare covers and doesn't cover. I'll be right back. Hi, Chris Duncan, independent insurance broker here again, and today's video is about Medicare and chiropractic coverage and a bill introduced into the House of Representatives called H.R. 3654, also known as the Chiropractic Medicare Coverage Modernization Act of 2019. And what caught my interest is an article I saw from Joe Ragusa and WSIL-TV in Southern Illinois, and the title of the article is Bill Would Increase Medicare Coverage of Chiropractic Services. And as always, I've provided a link in my blog article and video description to Mr. Ragusa's article if you would like to view it. This article is very short with very little details, but it got me thinking that a more detailed article and video about Medicare and chiropractic coverage could help some Medicare beneficiaries that rely on chiropractic coverage. And we often are asked if original Medicare covers chiropractic services, and the answer is yes, but very little. Medicare only covers subluxation or manipulation of the spine, and the best place to look for many questions to what Medicare covers is looking at the official handbook of Medicare called Medicare and You. And in the 120-page document, there is mention of chiropractic services in 2 short paragraphs on page 33. And if I've edited this video correctly, they should be on your screen now. And what Medicare and You states is Medicare covers manipulation of the spine if medically necessary to correct a subluxation when one or more of the bones of your spine move out of position when provided by a chiropractor or other qualified provider. That is all Medicare covers under chiropractic services. Medicare and You goes on to note Medicare doesn't cover other services or tests ordered by a chiropractor, including x-rays, massage therapy, and acupuncture. And the term by a chiropractor is a very important term when getting x-rays and other chiropractic services covered. See, if your chiropractor orders x-rays, massage therapy, acupuncture, or anything else, those are not covered by original Medicare. And if the chiropractor performs those services, they are likely to send a bill for those services. And if a Medicare beneficiary does have spine manipulation and it is covered, it will be covered under Part B of Medicare. And if you've seen my videos in the past, you'll remember a good rule of thumb to figure what part of Medicare will cover a service. And generally speaking, if you go into a building and you come home the same day, it is likely going to be covered under Medicare Part B. And under Part B of Medicare, the beneficiary will be responsible for the once per calendar year Part B deductible, and in 2019 it's $185, and the 20% coinsurance as well. Now, a Medicare Supplement plan, also known as a Medigap plan, may have coverage to pay the Part B deductible and the Part B 20% coinsurance as well. And if you'd like more explanation on the different Medicare Supplement plans and to learn which plan will best fit your needs, feel free to contact us. Now that's how original Medicare covers chiropractic services. I'd like to touch on how Medicare Advantage can cover a chiropractor. And a Medicare Advantage plan, as you know, is a replacement of original Medicare by private insurance, and Medicare Advantage is allowed to have additional services covered that original Medicare doesn't cover. And because the Medicare Advantage plan is run by private insurance, they can have coverage in place for x-rays, massage therapy, and acupuncture, even if they are ordered by the chiropractor and performed in a chiropractor's office. Now, when looking at a Medicare Advantage plan, it is imperative to do a lot of research on the plan you're looking at. Medicare Advantage can be very tricky and has many different rules from original Medicare, specifically doctor networks. And if you pick a Medicare Advantage plan when you are first eligible for Medicare, you may not be able to get a Medicare supplement for what's called guaranteed issue, which means the Medicare supplement plan cannot ask you any questions or deny you coverage. Also, if you've seen my other videos, you know I'm not an advocate for Medicare Advantage, but I also wouldn't discourage a client from looking at a Medicare Advantage plan either. We have many happy clients on original Medicare with a Medicare Supplement and Part D, And we also have many happy clients on Medicare Advantage as well. And our goal is to have conversations with our clients and come up with what is the best solution for exactly what their specific needs are. We even have husbands and wives on separate coverage. A husband might have Medicare Advantage for his needs, and his wife may have original Medicare with a Medicare Supplement in Part D for her needs. And like I said, we look at each case individually. Next, I'd like to quote the article by Joe Ragusa, and the quote is from Dr. Brad Miller, and I assume Dr. Brad Miller is a chiropractor, even though the article doesn't state it. But the quote is, "One of the things that are not covered by Medicare is the exam and any diagnostics. The challenge is, in order for us to have a working diagnosis, we have to do those services, and Medicare actually requires us to do those services to our patients." So according to the quote, when a Medicare patient goes to a chiropractor and gets a covered adjustment, they must also do other services as well and tests, and those are not going to be covered by Medicare. And to illustrate further, I found a document from CMS, also known as the Centers for Medicare and Medicaid Services, and the link is in the blog article and the description of this video as well. And the quote is about billing and coding guidelines. And what I specifically would like to look at is under non-covered services. And it states, all services other than manual manipulation of the spine for treatment of subluxation of the spine are excluded when ordered or performed by a doctor of chiropractic. Chiropractors are not required to bill these to Medicare. Chiropractic offices may want to submit charges to Medicare to obtain a denial necessary for submitting to a secondary insurance carrier. Now, I'd like to clarify what this probably is referring to, and it's for those that have Medicare as a primary insurance and a group health plan as secondary. The chiropractor will need a denial from Medicare as the primary to bill the secondary insurance to have it covered if the secondary group health insurance covers chiropractic services. This is not referring to a Medicare supplement plan, which many times is referred to as secondary insurance. If Medicare doesn't cover a claim, then in turn, the Medicare supplement will not cover it either. And the following are examples of services that, when performed by a chiropractor, are excluded from Medicare coverage. And this isn't an all-inclusive list. And they are laboratory tests, x-rays, office visits, physiotherapy, traction supplies, injections, drugs, diagnostic studies, including EKGs, acupuncture, orthopedic devices, nutritional supplements, and counseling as well. Before I get into the specifics of the proposed bill in the House of Representatives, I'd like to quote a blog article from the president of the American Chiropractic Association, Robert C. Jones. This is from the ACA's website, and as always, links are provided to view for yourself. And the title of the article is Support H.R. 3654 and Medicare Parity for Chiropractors and Their Patients. This is something obviously that the ACA is going to be in support of. And Dr. Jones states, for doctors of chiropractic, the bill will fully recognize DCs as physicians in the Medicare program, acknowledging their level of education as well as the level of care they provide, and also bringing coverage of their services in line with how other physicians in the Medicare program are treated. At this time, DCs are the only physician-level providers whose services are arbitrarily restricted by statute. As of now, Medicare doesn't consider chiropractors physicians or doctors, and they are not able to order services that are covered by Medicare. So let's get into the specific bill now and how H.R. 3654, also known as the Chiropractic Medicare Coverage Modernization Act of 2019, can change Medicare chiropractic coverage. This is bipartisan legislation introduced by Congressman Brian Higgins, Democrat, New York, and Tom Reed, Republican, New York, on July 9, 2019. And in reading the bill, the purpose is stated as, this act to expand recognition and coverage of a doctor of chiropractic as a physician under the Medicare program in connection with the performance of any function or action, including current service of manual manipulation of the spine to correct a subluxation as is legally authorized by the state in which such doctor performs such function or action. The bill would eliminate a portion of Section 1861 R5 of the Social Security Act, Title 42, United States Code 1395 XR5. Now you should be seeing the whole quote, and you can pause the video here and read it if you like, and use the link provided to view it for yourself if you want to. But I will focus quickly on a couple of areas. One, a chiropractor who is licensed. Notice the chiropractor isn't called a doctor. And two, and only with respect to treatment by means of manual manipulation of the spine, meaning that's the only thing that's covered. Now, that whole section I've highlighted would be replaced with a doctor of chiropractic who is licensed as a doctor of chiropractic or a chiropractor by the state in which the function or action is performed, and whose license provides legal authorization to perform such function or action in such state or in the jurisdiction in which the function or action is performed. Notice the change in wording from chiropractor to doctor of chiropractor. This is consistent with the purpose of the bill to recognize a doctor of chiropractor as a physician in the eyes of Medicare. And eliminated are the words only with respect to treatment by means of manual manipulation of the spine. This can be interpreted as additional coverage under Medicare as ordered and performed by chiropractors. Does that mean if H.R. 3654 is passed, chiropractors will be able to order, perform, and bill Medicare for these tasks, as do regular doctors and providers do now? Let's look at the purpose of the bill again. It is the purpose of this act to expand recognition and coverage of a doctor of chiropractic as a physician under the Medicare program in connection with the performance of any function or action, including current service of manual manipulation of the spine to correct a subluxation. This bill would label a chiropractor as a physician now, and the words, the Medicare program in connection with the performance of any function or action, certainly suggest under the new law, if the bill is passed, a chiropractor would be able to order, perform, and bill for their own procedures. We will have to see if the bill is passed and what actually transpires when the law goes into effect. If passing the bill does indeed allow chiropractors more latitude to order, perform, and bill for their own services, much as regular physicians do, it would in all likelihood lead to expansion of services by chiropractors. To sum things up, as of now, Medicare has very little coverage for chiropractic services. However, with the passage of the bill and adding physician status to doctors of chiropractic, perhaps it would make it easier to allow chiropractors to order more tests and services to provide better healthcare services for Medicare beneficiaries. We hope the information from this video was useful for you. Again, I am Chris Duncan, independent insurance broker, and our company helps people with Medicare every day with their Medicare choices and other retirement needs. We help with the decision process to best fit their particular needs for Medicare Supplements, Medicare Advantage, Part D prescription plans, dental, vision, hearing plans, and all of our services are 100% absolutely free. If you found this info helpful, please do me a favor and click the thumbs up button. Leave a comment about our video or ask any questions you like. This lets YouTube know we're putting out relevant information. Also, don't forget to subscribe to our channel and of course click the bell as well to get notifications when we put out more videos. Thank you for watching, and we can also be reached directly at 800-910-3382. Thank you.